Obsessive-Compulsive Disorder, or OCD, is a complex and debilitating psychiatric condition that affects millions of people worldwide. It manifests through obsessions, those intrusive, recurring thoughts that generate anxiety, and compulsions, which are repetitive behaviors performed to try to reduce that anxiety. It's not about perfectionism or simple habits. OCD is a real disorder that can deeply interfere with daily life, work, and social relationships. Obsessions are unwanted, disturbing thoughts, images, or impulses that just can't be ignored. They might involve fears of contamination, constant doubts about actions already completed, aggressive thoughts toward oneself or others, or even a need for perfect order and symmetry. Compulsions are the rituals the mind creates to cope with the anxiety caused by obsessions, like repeated washing, obsessive checking, counting, or arranging objects in really precise patterns. These behaviors may seem irrational from the outside, but for those who experience them, they're actually attempts at survival. Every day, those living with OCD face hours of anxiety, isolation, mental exhaustion, and frustration, and honestly, awareness of how irrational their behaviors are only amplifies the distress, making daily life feel like a constant battle. OCD arises from a combination of genetic, biological, and psychological factors. Studies show a hereditary predisposition, especially among first-degree relatives. Neurobiologically, alterations in brain circuits that regulate anxiety and compulsive behavior, particularly in the basal ganglia and orbitofrontal cortex, trigger obsessions and rituals. The environment also plays a role. Chronic stress, trauma, or rigid upbringing can favor the onset of symptoms. OCD is therefore the result of a complex interplay between mind, brain, and lived experience. The disorder can severely compromise social and professional functioning. Hours spent in rituals reduce time for work, family, and relationships. Constant anxiety leads to isolation, fatigue, and frustration. Many people experience guilt or shame, further worsening their quality of life. So, the diagnosis of OCD is actually based on the observation of symptoms, how long they've been present, and how much they impact daily life. Clinical tools and rating scales are also used to help determine just how severe the disorder is. The most effective treatments usually combine a few key things: cognitive behavioral therapy, especially something called exposure and response prevention, which helps patients learn to face their obsessions without turning to compulsions. Medications, particularly SSRIs, are often used too, since they help modulate the brain circuits involved. Plus, psychological support, stress management techniques, and resilience strategies all play a role. With proper treatment, many people are able to control their symptoms and honestly, see a really significant improvement in their quality of life. OCD is not a whim or simply excessive perfectionism. People with OCD are aware of the irrationality of their behaviors. The disorder does not disappear on its own, but can be managed with effective therapies and psychological support. Imagine a mind that never stops. Relentless thoughts, recurring images, irresistible impulses. This is the world of someone living with OCD, a constant battle between reason and impulse, between the desire for control and uncontrollable anxiety. Every gesture, every ritual, every obsession tells the story of the complexity of the human brain and the fragility of psychological balance. Studying and understanding OCD means acknowledging real suffering, breaking down prejudice and stereotypes, and valuing the importance of effective therapies, support, and scientific information. OCD is pain, anxiety, and fatigue, but also resilience and hope. Every small step forward is a victory, a step toward control, toward mental freedom, toward a more balanced and fulfilling life.